All right, good morning, everyone. Before we get started, why don't we stand up and have a prayer and a pledge of allegiance.
Dear Heavenly Father, we thank you today that we can come together and represent our county, Lord, with our leaders and our local leaders and our government officials and our state leaders, Lord. And I pray that you'll be with us as we conduct your business for the county and that we'll all make the best, wisest decisions, Lord. And pray you'll be with our county as we fight this pandemic. Be the ones that are sick today, Lord, in the hospitals and at home, that they'll recover and that we'll make it through this. Continue to bless us and thank you for all your blessings you give us. In Jesus' name, amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, welcome to Commissioner's Court, our first meeting of the month of February. Today is the 14th, Valentine's Day, February 2022. It's just after 9 a.m. Item number one is our public comment time. Anyone have something that they would like to speak to the commissioners about that is not on the agenda? You may speak on an agenda item if and when we get to that, but this is general comment time if there's anyone that would like to speak. I do have a young lady that does want to speak to us about our ongoing opioid litigation. We will not be making any decisions on that, but she brings us some good news from our attorneys in Tyler, and we will slip her in when she gets here. We will move on to item number 2, consider and possibly approve minutes from our January 24th, 2022 special meeting of the Commissioners Court.
Make a motion to approve.
Motion is made to accept that set of minutes and approve them by Commissioner Parchman.
Second.
And second by Commissioner Applewhite. Any discussion or comments? All in favor say aye.
Aye.
Item number 3, here's a face we haven't seen in a long time, and he's been a busy guy and still is. And I am very proud to introduce to you Terry Scoggin, our Chief Executive Officer from Titus Regional Medical Center. And Terry's got a busy job even when you don't have a pandemic, and so you layer that on top of there, and this is a man who hasn't slept in 2 years. And Terry is here because I wanted him to be here. Terry wants to talk to you about some specific needs, and specifically I want you to keep his communication with us in mind as we get closer to considering possible uses for our ARP, American Rescue Plan Act monies. But Terry, can you give 30 seconds update on what's your status? How many COVID patients do we have in the hospital?
As of this morning, we have 6 COVID patients on our floor and 1 in our ICU. We still have 7 patients in. We are on the down of our 5th surge. Majority of Texas has had 4 surges. Titus County has had 5 surges. So this is our 5th one. At our highest in this last surge, we were up to 22 rooms that had patients with COVID in, but 9 patients holding our emergency department. So over 50% of our emergency department were COVID patients being held because there were no rooms here or any other hospitals in the state of Texas. We're on a down surge over the last week. We've seen that go down the last 2 weeks. We run about 2 weeks behind the Metroplex. And Judge, you know I love numbers, so I track a lot of the state's numbers. And we run about 2 weeks behind Dallas, about a week behind Tyler, Smith County, and Gregg County on our numbers. They've seen the peak. Tyler has not. Smith and Gregg County are still on the uprise. And at that peak, we hope they'll come down. But we've seen it over the last week. We've seen it. First of all, thank you for the opportunity to come this morning and to present to you guys. Sorry I don't come to Commissioner's Court more often. I should. As a part of the county, I need to spend more time here, and I'll do that going forward. Since he's here this morning, I personally want to thank the Chief and Judge Brian Lee for the work that they did over the last 22 months. And it's hard for me to believe It's been 22 months. We started, our first meeting was in March of 2020, and we called the community members. The fire chief called me, and we got, that afternoon, we were hoping to have 20 people in a room. We had over 90 people in a conference room. A week later, we learned about social distancing was, so we didn't know that in March when we had all those people show up. But Pilgrim was there, the school districts were there, county officials there, when we first started describing from our physicians what COVID was. 22 months later, Titus County has worked together over this. We've learned a lot of things together, and I appreciate the chief and the judge for their leadership and working with the hospital and the other agencies in town to put our best foot forward. And I think we've had. TRMC is the only independent hospital left in Northeast Texas. We are a hospital district. We receive less than 5% of our funds that we use on an annual basis from tax dollars. We try to use those tax dollars on an annual basis for capital improvements. We spend about $4 million in capital improvements. That's what we receive in tax dollars. That's our goal. So we try and reinvest tax dollars in improving things in our community. COVID has been amazing. It's been just the worst and the best at the same time. I've had the opportunity to watch physicians and clinical team members give of their lives for the last 22 months to help this community. If you look on the back of the article I gave you, I keep track of COVID per 100,000 and mortality. As you can see, Titus County has the second highest COVID per 100,000 in Northeast Texas in those 27 counties. However, we have the second lowest mortality rate. Even though we've had the highest, we've had the lowest. And I think the reason that is because we're an independent health system. We work closely with our community, both the city and county resources to provide for this community. Decisions are made local. The hospital board of managers and the physicians here make the decisions. Over the past 22 months, our physicians have come to the table and we've made changes on a day's notice. We've opened up clinics. We converted our registration area to an emergency room clinic to help relieve. We did the monoclonal antibodies before it was cool when the governor gave it. We were doing it here locally. We've given thousands and thousands of vaccines. We've done everything needed to keep it local, but because it's local, we can make community health decisions, and I think we did that. We've saved lives in Titus County and the 4 surrounding counties because of the decisions we made, and I think it's a testament to what our county's done, our city's done, and the health system's done together to do that. So I want to thank you to them for the work and allowing us to do this. I'm coming today to ask for $169,744 of the ARP funds when Titus County allocates them over the next 12 months. Last July and August was our 4th surge. Up until that point, we received state nurses to help. Staffing has been our biggest issue, and I'm proudly to say in the 22 months, we've not closed our doors once. It's called going on divert, and emergency rooms can go on divert when they're overwhelmed. All the hospitals in Northeast Texas at some point have closed their doors at some point. We've kept ours open. We don't have any place else to go. The next health system of our equivalent is 60 miles in all directions. Now, I can't tell you the waiting room in the emergency department hasn't got up to 4 to 6 hours. It has. We've had ambulance waiting with gurneys in the middle of the hallways in the back until a doctor can free up. But we haven't shut our doors. We have spent the money that we received from the federal government and the state government, and we spent our own money on contract staffing, contract physicians. At our highest, we normally have a intensivist, an ICU physician here 12 hours a day. At our highest, we've had 2 ICU physicians here 24 hours a day because of the acuity that we had in this community that you weren't able to get out and we kept here. And because of the medicines we were given from our physicians, we believe we saved those lives that may not have been saved other places. In July and August of last year, we reached out again to the state for additional staffing. At our highest in February, we had 80 nurses that were here of the thousands that were across the state of Texas. We got a response at that time from the state. The chief was a STAR request was made, and it goes to the chief, and the response he got back was to use local funds for it. And that's just when the ARP funds had just come out last summer. So the state had made the decision that they would not provide staffing, they would provide local funds. About a month into it in September, late August, early September, the state realized there's not enough of the local funds to continue to say that, so they re-engaged contract nurses and started getting, and we did get a few. I think we got between 20 and 30 at that time. But at that time, we were spending contract agencies and spending it. So the dollars I'm asking as part of the ARP, $3 million that the county has, is I took July and August contract COVID that we spent, averaged them together, and then 55% of our Medicare patients are Titus County. We serve the 4 counties around Titus plus Titus County. And that's a benefit to us because the surgery we get and the other things that we get from those 4 counties help fund our health system and provide better for Titus County. So it's a win for everybody. But what I've put in front of you is an average for July and August for 55% of 1 month, which comes out to $169,744. And when the county makes decisions in the ARP fund, we would like for them to consider Titus County Hospital District's request. Questions or?
Well, these are impressive numbers, and I've known about that, but do take a look at that, at the exceptional job or the exceptional blessing or combination of the two that we've had here. And explain that second column there, COVID per 100,000 patients. What does that exactly mean? That's how many we've had that have had it, or what does that mean?
How many cases in Titus County? So what Johns Hopkins University tracks this data, and it's the reason why they put it in 100,000, it puts it into equivalent. So when you look at the state of Texas or you look at any county, Smith County has quite a bit more than Titus County. But when you take your count, you take your COVID cases divided by your total population, then multiply it times 100,000 patients, that's what it would equivalent to. So if all if all city counties in the state of Texas were equivalent, we'd be at 25,961, which is the second highest of the 27 counties in Northeast Texas. Only Delta County, which is very small. Delta County has the highest COVID per population and the lowest fatality rate. But 25,961 is higher than the state's average of 22,475, and we're a little bit off the state's fatality rate. I will tell you, we've learned, and I've been a part of many articles written, articles and interviews over the last 2 years. We focus on rural care. And we're not only fighting for Titus County, but we're fighting for Texas rural hospitals and the United States rural hospitals. COVID has killed rural America at twice the rate it has at normal. And it's not COVID where the deaths have happened. It's the underlying conditions. And Gigi talked last week about all the weight he's lost. It's our underlying conditions in Northeast Texas. And I'm a prime example of a bad Northeast Texas man. Weight, don't exercise enough, stress, work too much, don't sleep enough. Those are things that we have to work on. That's what killed people. COVID was just what was going on at the time, and if you had diabetes or heart issues or underlying conditions, you were weakened, and COVID impacted you differently. So those are the things that in 2022 we're committed to fixing. We want to work more in the community and do community efforts to try and improve the community health of Titus County and Northeast Texas.
Any questions for Terry? Terry, I think that's a very reasonable request. Again, we are in the very early stages of talking about this. We have not committed any of our funds yet. We are still kind of waiting to see what the reporting requirements are going to be to help us determine what level of assistance we're going to need in the way of management of this grant, how much we can handle ourselves, how much assistance we can get from a professional manager that will help us be sure that we're spending money in the appropriate places. And so, not stalling you, just saying that's where we are. But this is a very reasonable request, and I certainly look forward to asking these guys to help you.
I appreciate the
when that time
consideration.
comes.
It's 5.66% of the total amount. When I talked to my friends at Hunt County, at Hunt Hospital District in Hunt County, they received 5%. Now, they asked for 100% of their county's funds, and we're not asking for that. They received 5% from the county, and I thought that was a reasonable amount from there. And then Gregg County and some others have given as well. So I appreciate it. And again, I think most everybody has my cell phone number. If you don't, the judge has it, Gigi has it. We'll be happy to help any way we can.
Thank you, Terry.
Thank you for your work. Thank you.
God bless you.
Thank you, Terry.
Much, Terry.
David, are you ready? I hate to call on you right as you're walking in the door, I can go to somebody else first if that'll help you get organized.
No, I think I have it with you, Judge. First off, I appreciate y'all letting me come in.
This is David Ivins. David, as you know, has been up here with us before. David's the one that is helping us with utility relocations on the FM 1735 project. Normally you would have Gary Leuba here from Lochner presenting. Gary had, to say the least, a bad case of COVID, and Gary was in tough shape and is recovering from that, and he felt it best to send David today. And David is going to, this is the second time we've done this, is we're going to be asked to approve some payments to the landowners. That the prices have been agreed upon. We've previously approved those. Now it's time to write the check. So,
Yes, sir. And just for the record, thank the good Lord above, Gary came to work today. He's just working half-time. He doesn't have much strength. Still didn't want to come into this meeting, but he is at least making progress. I wanted to let y'all know that. And yes, sir, I'll try to be quick. These are approvals that you guys have already approved. The purchase price, what we're asking for is a check for closing that I can carry to the title company, and they can set up the closing. So if we want to just get started, parcel number 13, we are requesting $97,735.96. Okay, parcel number 15, we are requesting $66,414.71. Parcels number 18 and 28 combined, we're requesting $18,942.21. And parcel 23, we are requesting $16,726.71. Those are the 5 additional parcels that I'm here to request the authorization for today. I believe that will bring the closings up to about 15. And there's a few more that they're pretty close to ready. They had a few title issues that they have to work out, but they're getting pretty close. So we are making good progress.
you gave us parcel 18 and 28 were both the same amount?
No, sir. They are closing as one.
Okay.
Okay, because
that total represents closing for both
yes.
Parcels. All right.
Yes. There is only, there's one owner. Actually, I believe it's 2 brothers, but, the title is vested in one, so it'll be one closing for that.
2 parcels, 1 check?
Yes.
1 check. Okay.
Yes, sir. Are there any questions of me?
And once again, we've already approved these. We know about the underlying parcel, the sizes, and we approved these purchase prices previously. Just time to write the check.
That's pretty much where we're at.
I make a motion we approve payments.
Motion to make these payments on these 5 parcels is made by Commissioner Parker and second by Commissioner Parchman. Any other questions here for David? All in favor, say aye.
Aye.
David, that was easy.
Thank you much. I'll stick around until after the meeting and get you to sign a few things.
That's fine. And David, I would say we've probably got at least an hour here. If you had anything else you needed to do, feel free to come. Feel free to come and go.
I enjoy county government.
Sure you do. Sure you do. Sure you do. Item number 5, it's our bi-monthly presentation by Chief McRae regarding fire protection in Titus County, along with the support of the City of Mount Pleasant. Welcome, Chief.
Thank you, Judge. Y'all should have a packet in front of you with the information we're going to go over today, starting with the attendance at the Chiefs meetings. As you can see, Argo, Sugar Hill, and 5-Star seldom have the chief there. Sometimes there's a representative there, but the chiefs from those departments rarely make the meetings. The next section is the volunteer membership and members training. That's a document showing training from June through December of last year. The categories are structure firefighter, structure fire support, motor vehicle accident support, wildland firefighters. And then the far right column is the cumulative number of hours that have those folks who've trained during that time period. If there's an X by their name under a category, they've got the training. If there's not an X, they have no training. As you can see, there are plenty of spots that have no X's. There is a number of people that have had no training during that time period or very little training during that time period.
Our yellow names are the professional paid firefighters that may be part of that, or that are part of that particular volunteer department, and then the oranges would indicate our more active in that they attend. They make at least 25% of the calls on a regular basis.
Yes. And the reason the guys in yellow, the career guys, their hours are so much more than the others because they have to have training on duty. The next tab is the monthly countywide training and attendance. For a countywide in November, we did vehicle fire training. As you can see, we had 8 people out of 96 show up for that. There were only 2 people that passed the class, and the rest of them have not come back to retake it. In December, we did not offer any training, which we had talked about that at the chiefs meetings. The page right behind that actually shows the training attendance from June 21 through December of 21, and as you can see, the attendance in those classes are not very good at all.
This is training that you're providing, or does it also doesn't count any training they might be doing at their individual stations?
That comes up under the next tab.
Okay.
Yes. Then there's the volunteer firefighter training sessions, and shows you that Cookville and Sugar Hill have not done hardly any training at their departments. There's an overall page there, and then there is for November and December broken down into who came to the calls, or who came to the training, how many came to the training, and what was trained on. And even on that, there's not a whole lot of folks showing up at the department's training sessions. The next tab is volunteer firefighter response. And there's a cover there showing from April of last year through December of last year. And you will see that it is rarely changed. The total number of volunteers may have changed from 121, probably at the highest. But there is only about 30-ish that actually make more than 1 out of 4 calls, or 25% of the calls. So over a 9-month period, there's nothing changing. It's not getting any better. In fact, it's probably getting worse. Sugar Hill has missed 71% of their calls from, let's see, probably the time frame. I didn't put that on there. I believe it was from November up until a few days ago, where they have missed 71% of the calls. Overall, from November of 21 through February the 13th, the overall county VFDs 41 times, nobody's responded to a call.
When you say they don't respond, do they let you know they're not coming, or they don't even answer the call?
Just don't answer. Nobody shows up.
Just during the day?
Most of the time. Most of the time. You know, the grass fires obviously are increasing. I ran a total from November 1st of last year, 21, up and through the 13th of February. The same time frame a year ago, we're at 205% increase over that same time frame. The grass fires are going to continue to get worse. The drought is out there. Just kind of an example, on the 16th, we had a fire in Argo. If you remember, that was the morning we woke up and there was snow on the ground. But that afternoon at 4 o'clock, the sun had come out, the grass had dried out, and there was a fire in Argo. One of the first things we had to do when we got there was get a civilian off the top of their truck that was running across the field. The next was to get them to put their protective equipment on. On the 28th of January, we had a fire out at Nortex. Commissioner Parker was actually at this one. He might elaborate on kind of how it went. Several houses were in danger. We were able to get from Nortex, they were able to send an engine, a brush truck, a tanker, and 4 members. Cookville, we asked for their help. They were able to send a couple of brush trucks and 2 members. From Mount Pleasant, we sent 2 command vehicles, 2 brush trucks, an engine, and 7 firefighters, which was actually, we sent more than 2 volunteer fire departments were able to send that day, more resources. On February the 7th, grass fire in Argo, which Argo didn't respond, and we were just barely able to get there in time to save the neighbor's hay from the neighbor that had started the fire. Same thing out in Nortex. Luckily, we were able to save those people's houses that day, but it was close that we almost lost some houses that day.
How did that fire start?
Brush pile.
Somebody not being careful with a brush pile?
Yeah. You know, we were, again, lucky that there was not a fire somewhere else at the same time we were out there. That was a day that the fire danger was pretty bad. It was windy, it was dry. If there had been a fire somewhere else, or if we'd have been on a call when that one occurred.
Is that the one that was in the paper, like 40 acres?
40 acres, 41 acres, yes, sir. Yeah. It jumped a road. We were able to catch it after it jumped the road. But with erratic fire behavior that day, the wind would change. So it was going this way for a while, and then it'd go this way, and then it'd go another way. You know, we just barely had enough resources to handle it that day. Just barely. How much Mount Pleasant support was there? We had, like I said, we had 2 command vehicles, 2 brush trucks, 7 engine, and 7 firefighters, which was more than the 2 VFDs were able to bring combined. Again, in the daytime. Even with all that, it was a tough fight. Yeah. Again, the fires occurred during the daytime. Most of the grass fires from about noon to 6. That's when most of the VFD's membership's at work. Yeah. So, the annual report that I sent to y'all earlier, it was probably a few weeks ago, just to go over that. The city and county calls combined for this year were up 12.6%. The city calls were up 4%, just the calls we made in the city. The city structure fires were down 37%. However, when you look at the county calls, they were up overall. All county calls that we responded to were up 30%, and the number of county structure fires were up 93%. So things are not getting any better. Things are getting worse, and we are not having we don't get the response from the VFDs to help us.
Do you think that that's, I mean, undoubtedly it's been impacted by your policy where you've told these departments, if you're not trained, don't show up at a fire and endanger yourself and us? Is that keeping your numbers down? Not that that's a bad decision, but is that weighing into their decision-making process?
I can't answer that. I don't know. I don't know whether.
Do you get any feedback from these chiefs at these chief meetings?
No. Other than that, they can't do it without us being out there. You know, for all intents and purposes, there is no volunteer fire department in Sugar Hill, Texas. Y'all are paying money to somebody up there, but they're not responding. There's not any good things going on in Sugar Hill, Texas. They're not attending the training. They're not responding to the calls. They don't send the chiefs meetings. I mean, from what I can gather, almost all their membership, well, a lot of their members have left, from what we can tell. So, you know, they won't come to
the chief is working out of town now. Chief Grubbs is working in Dallas.
At times he is, from what I understand. Again, there's no communications. You know, Chief Eubanks, which takes care of the BFIS insurance for the county departments, was also informed that according to BFIS, if a volunteer firefighter gets hurt on a wildland fire and they're not wearing NFPA approved gear like they're all supposed to have, they're not going to be covered. Workers' comp will not cover them. So
I've yet to get a response on whether or not they are currently covered under a work comp policy. I heard it lapsed. I sent a couple of emails to the chief. I never heard anything from Chief Grubbs about that. You don't happen to know the answer on that?
no, sir. I do not.
Supposedly they'd sent the check in.
I think they have. But supposedly we still don't know for sure.
Right, but I'll find out.
But like I said, for all intents and purposes, there is no fire department in Sugar Hill. The number of overlapping incidents that we're going to, which means there's more than one incident happening at a time. There's a sheet there showing the calls in 2021 that on average through 2021, the overlapping calls were at about 12%. It had a couple of or 1 month there, it was almost 30%. I ran the report for January. I believe it was almost 30% that month. Of course, that'll be at the next meeting we do. But again, things are not getting any better.
And overlapping means that can be an incident going on, one in the city, one in the county, or two in the county. It doesn't matter, just where you're having to divide resources.
Just means that there's more than one incident going on at the same time somewhere. You know, we have been lucky in that the stage of the first fire has been such that we've been able to either break resources loose from it to send it to the other one, or we were finishing up maybe for the first call just in time to go to the second call. You know, our luck's going to run out sooner or later. The agreement that y'all have with the county VFDs has them to do certain requirements. The status of SOPs and equipment, like testing records and what have you, shows there that we still have departments.
That's going to be the third page, about the fourth page from the back is what he's talking about. Status of SOPs.
Status of SOPs, equipment, testing records required by the agreement. Anything that's in red has still not been delivered. So the last page, or probably in that handout, is the drought. That is from January the 25th. Last Thursday when I printed it off, it was a little bit better, but we're still in the severe drought for Titus County. Some of the extreme drought had gone away, but that's short-lived. The little bit of rain that we're getting doesn't really affect the drought that much, and it does not affect the dead fuels that are out there, except while it's raining. Dead fuel, the grass, does not get moisture from the roots. So you can have water standing and have the fire burn right over it because the grass is dry. When the only way dead grass gets moisture is either raining or from the relative humidity in the air. And we've had the relative humidity in the air down to 13% one day last week, which means pretty much the probability of ignition from any type of spark was 100%. Couple that with the wind, and you have a very dangerous situation. I've made these presentations to y'all now for almost 8 months. Nothing's changed. It's the same stuff every time.
You're referring back to that status of standard operating procedures and equipment testing records by the agreement. This is what I want to bring to your attention and ask you to be thinking about what you want to do about this. You've got several headings here of items that are specified by our agreement with the volunteer fire department that we expect this for the monies that we are providing to you. We do have several here in red that are obviously non-compliant, and you see some patterns there by department. My question is, at what point are we going to say you're not abiding by the terms of the agreement, and therefore we're going to temporarily discontinue, permanently discontinue, whatever you want to do, your monthly funding? I know it's tough to pick on one or two if you're going to expect perfection, but I think that we all agreed we had a very reasonable contract or agreement or whatever you want to call it with each of these departments. They were all agreed to, they were all signed, but we're not getting compliance there. And so I will likely put this on a near future agenda to ask you what you want to do about this. If we want to start off with a gentle reminder that we do expect this to be completed. Chief, do you get any feedback at these chief meetings as to anything that the county can do different? Is there a common theme? Is what we just suffering from a continued erosion in volunteer capability? What might we can do? What could we possibly do to improve things? When we don't even get response, that does bother me. I know somebody can't even answer the radio and say, not available, and it's just radio silence.
We've done everything, and I say we, the chiefs over the last, probably 5 years, 6 years have tried everything to get new volunteers. They've advertised at the show. When you go out there, those advertisements, they tried that. They've tried, community fundraisers and advertising during that. The volunteers just are not there. The people that want to be volunteers are just not there. And the ones that have joined the department, and again, Sugar Hill, when Sugar Hill went down and there was the community outcry of we've got to have a fire department, and you had about 20 people put their names on a piece of paper. Well, that's what it's turned out to be, names on a piece of paper. There is no fire department in Sugar Hill. So, occasionally we'll see somebody, but that's not the case. Same thing in Argo, some of the other departments. There's just, when they do respond, it may be 1 or 2 people. And sometimes it's even after we're there. We've already got there, got the fire controlled, and then they show up. Judge, I don't have an answer for you. It's whatever level of fire protection y'all want to provide in the county. I'm just telling you, we're struggling in the city to be able to continue to do what we're doing in a safe and efficient manner. These are just a couple of examples I gave to you, some close calls, but I told y'all at the last meeting sometimes calls we've had with, each one call after close call for us. When we have the chiefs meetings, we talk about what's going on, but they really don't have any answers either. You can't make the volunteers respond. You can't make them train. You can't make them join.
We've lost quite a few of our mature layer of firefighters in the last couple of years that were the ones that we counted on being there from time to time. And, you know, let's face it, all good things eventually come to an end. You make a decision to retire.
Even the members we have now in the VFD, some of them are aging out, we'll say. And there's no young ones coming in behind them to fill those positions. So, you know, some of us that are older, I know Jimmy over there is kind of close to my age, and it's, you know, there are departments.
No laughing, please.
You're not that far behind. But I mean, the guys are hanging up. Jerry Clark, the chief of Sugar Hill, he finally hung it up. He was 75 years old. Just said enough's enough.
Yeah.
And that's kind of where we're headed with these other departments. Enough. Sooner or later, the next year, 2, 3, those folks are probably going to say enough's enough. Yeah.
Okay. Thank you.
But the fires are still going to burn.
I will say, going back to that with Larry, there's several of us, well, 3 or 4 of us on our department out there that we just can't keep going. I mean, we've got some younger guys on there. We've got somewhere around 15 to 17, I think it is, on our roster. And these guys, they can only do so much. And the younger guys will I told them at the last meeting, I said, guys, y'all are going to have to step up. I said, us older guys have got to back off a little bit. I said, we've already had 2 fatalities from people on a department this year, and or on the county departments, and I said, y'all have got to step up. I said, we will stay here and help you and try to train you and do whatever needs to be done, but I said, we can't keep going and doing all the work. And a lot of them, like everybody else, they work during the day and they can't get loose. I try to make myself available when possible to go, and there's not a lot I can do. I am not going to go into a structure fire unless it's something that has to be done to save somebody's life or something. I'll do that. I'm structural certified, but as far as going out every time we have a fire and going into a structure fire, I can't do it. I just can't do it. And so that's where the major problem is with our departments. Every one of them, not just ours, is getting people to step up and say, hey, we want to do this. And we've tried everything in the world, but just nobody wants to do it anymore. They just don't want to volunteer. I'm with the Titus County Fair Association. We can't get volunteers there to even come in and help. I mean, they'll say, oh yeah, we want to help. Well, okay, be here so-and-so time. Never show up. So it's not just the Fire Association. It's a lot of volunteer stuff that's going on. But another thing that I'd like to throw out, Larry was talking about that fire we had out there, that 40 acres. That was one of the worst wildland fires that I have been on. And I've been on different fire departments since I was 18 years old, and that was a long time ago. And that fire was doing some stuff out there that I've never seen one do, and a lot of it was because I think it was 18% that day, the humidity.
Pretty close.
People do not understand that when that humidity is down below 30%, that fire just it goes crazy, and you don't know what it's going to do, and you can get yourself in a bind in a hurry. So I just want people to understand that you know that's where we're sitting with our departments, and we've got to have help to continue with what we're doing. The equipment's not a problem. We've got all kinds of equipment, and that's really not our problem. It's the volunteers. It's where what we've got. They work good together, and we can, you know, if people can get there, then we can get the job taken care of. But until we get people to come out, then we can't.
Yep. As far as equipment, like Jimmy said, not counting our equipment in Mount Pleasant, there's 17 brush trucks, 7 tanker pumpers, I believe, and 3 engines, and they're all in good shape. It's just the people. You know, if we could staff that every day, we wouldn't have a problem. That ain't happening.
Well, I appreciate the fact that you do provide us with a lot of support, that guys that are trained, that are capable, that are willing. And I understand there's a big difference in a paid professional and a volunteer, but I also understand there's a lot of management that goes on in managing enough staff, not only to take care of the city of Mount Pleasant, but having a staff large enough that you can take care of the city and take care of the county, which is obviously occurring at a higher and higher and higher level the longer that we go.
You know, as for the city, we're continuing to grow. We're adding homes and apartment complexes and, you know, some subdivisions. So our responsibilities inside the city continue to grow as well out in the county, with more houses being built, which again complicates a grass fire. We're used to just being open field. Now we've got a $100,000 house sitting out there in the middle of it, or a subdivision it's burning into, which complicates things, where you could just let the fire burn maybe to a road and put it out. Now you got all these houses, just like out there the other day. It wasn't a subdivision, but instead of just open fields, now we're dealing with somebody's houses and barns, and, you know, that complicates it.
Yeah. Commissioners, any questions while you've got the chief here? Jimmy, thanks for your input. Well, again, we appreciate the time and effort you put into these reports. I wish they gave us and you better information, but we've got to deal with the reality, and this helps us be better prepared for when we sit down and talk about, contractual obligations between the city and the county regarding fire protection. And this is the year we'll renew that contract.
Yes.
And I know that those discussions need to begin soon.
Yeah, the city folks met one day last week and kind of started some of our discussions, and I'll be getting with you to get you some information we can start looking at it.
Very good. All right. Thanks again.
Yes, sir. Thank you.
Thank you, sir.
Thank you, Larry.
Jody, am I pronouncing it right?
Yes, sir.
Have you had a chance to catch your breath?
I have. My apologies.
Don't apologize. I was ready to squeeze you in when you got here, and my apologies that I do not have you on the agenda today, but the lady that did call that I spoke to, we decided that we do have some time between now and March 8th, I believe, to make a decision on this, and we did have some problems getting time for somebody to attend one of our meetings. But I would like you to go ahead and present in the form of public comments whatever you can that doesn't have to be, and does any of this need to be in an executive session at this point?
The slideshow materials that I have in my hand should be only attorney-client, but
Okay.
I can share the content with everyone.
Okay. Why don't you share the content? Let me ask you this. Do you feel like, what can we accomplish today that will give us enough information to be able to vote either at our next meeting or at a special meeting that I might put together between now and 2 weeks from today?
Sure, and with your permission, may I approach the lectern?
You sure can. Thank you. I think it's ready.
Well, today I can give you an overview on the litigation as a whole and what we've been up to in the state of Texas, working for our clients, which are mostly subdivision counties such as Titus.
Will you tell us the difference in your firm and the one that I've been talking with, or Martin's firm, I guess?
With Reed Martin's firm?
Right.
Right. So I work for Simon Greenstone Panettiere out of Dallas County. I'm the case manager. I manage the litigation for Jeffrey and specifically the Dallas County case, which is a bellwether. A bellwether is what we like to think of as a test case. The opioid litigation is new. And so we had to start from the beginning, start from scratch. New documents, new theories of liability, new legal theories. And Reed Martin at Martin Walker out of Tyler, they're our local counsel for many of our subdivision clients in East Texas.
Thank you.
Yes, sir. Okay, so much has happened. I'm sure a lot of y'all watch the news and read the papers. Just yesterday in the New York Times, there was an updated article about the opioid epidemic. I'm in the unique position of litigating an epidemic during a pandemic, which is extra fun. It's unfortunate that the pandemic has sort of taken some of the steam out of the work that we were hoping to accomplish in opioids, but we've managed to get a lot done anyways. When you first filed your lawsuit, there was really only one litigation happening, and that was in Ohio. And that's managed by a judge named Aaron Polster, and he runs a big federal MDL. We have some cases in there. Now, in the meantime, we were able to set up a Texas MDL because, you know what, we're Texans. And we don't really want a judge in Ohio administering our money, right? We know our problems. We know what solutions we think we can come up with to address our problems.
What's an MDL?
A multi-district litigation. So basically, a big group of cases goes under one judge at the federal level, and that's the Ohio litigation. Well, we were able to construct the same structure out of Houston, and that's where your case is. And this has been the greatest thing that's happened to opioid litigation for Texans. What this has allowed us to do is to put pressure on the defendants to come at them with facts, with law, with everything we got, really, and bring them to trial. And it took about 3 years. Dallas County was selected as a bellwether, it must have been summer of 19, and shortly thereafter, we started producing documents, and we produced 2.2 million documents. We took 187 depositions in about 4 months last year. I was in depositions all day long. We pulled every autopsy going back to 1990 that had anything to do with toxicology. We analyzed all the records. We pulled every indictment, every probable cause affidavit we could find. Because, you know, in Texas, most of the crimes involving drugs are coded as possession of controlled substance. So unless you dig into it, you're not going to know if it was meth or cocaine or a prescription opioid. And so the defendants challenged us. They said, oh, you can't just show up and say your problems are our fault. And we said, very well. So we pulled all the proof. We analyzed the proof. We hired 24 experts. We spent millions of dollars of my boss's money. Massive database that we have with all of our documents, all of their documents. We search it at lightning speeds. And we forced them to trial. Our trial date was last Monday. And a number of them decided rather than risk a Texas jury, they would pay some money. And they're paying a lot of money. Now, we work very closely with the state of Texas, with your Attorney General. And with the Texas term sheet, which this court passed by resolution probably a year ago, we came up with a way to divide the proceeds. And as you recall, roughly 15% goes to the counties for whatever you want. 15% is just your funds. 15% goes to the state, and then 70% goes to a big abatement fund for regions. And your region is Region 1. It's mostly this chunk of Texas, this part of East Texas. I was in Trinity County last week, and they're part of Region 1. And y'all are going to have $40, $50 million that you can apply for your programs. And when we talk about programs, let's say, for example, your fire chief wants to have Narcan on the ready in case they go into a scene and maybe someone has some fentanyl there. And maybe a SWAT team officer breathes in some fentanyl and starts to have an overdose. Well, having that Narcan there can immediately stop that and save a first responder's life. Or maybe you want to offset the cost of drug testing for your criminal courts. Most of the drug testing doesn't cover very specific opioids because those tests are expensive and the counties don't have money for them. So you can offset those costs through the abatement fund. Maybe the cost of autopsies. Let's say your JP sometimes, makes a call and they say, well, I really wish I could send this to the medical examiner in Houston or Dallas, but we don't really have the money in our budget to do that. Well, now, if it's something involving a drug or an opioid, maybe you can use that to offset the cost. So the Abatement Fund is going to be critical for the counties to implement programs that you actually need versus having, a group come in and tell you what you need. You get to offset things that you already need and talk to your criminal courts and, maybe start a divert court. There's so much you can do. So as to the business that I'm here for today, I'm very excited to tell you that Endo Pharmaceuticals, an almost bankrupt company, is paying $63 million to Texas. It's already here. The money's already here. And just so you know, that's far beyond what they paid the Appalachian counties in Tennessee when they settled, which is a big deal because most people think that Appalachia is really the only place where there's an opioid epidemic in the country, and I'm here to tell you that is not true. Texas has a major epidemic, mostly related to hydrocodone. And while we don't have the mortality rate and people driving, into Tennessee to get these pills, we have a lot of people who are functioning addicts that, but for having the hydrocodone, would be in some real trouble with withdrawals. We have $150 million from Teva, plus $50 million in cash that they're paying this first year. And Teva is putting in $75 million in Narcan. And the Narcan will be administered through the state. So that could easily support your state troopers, your DPS officers who work in and around Titus County. And then the big one, this one I'm very proud of because I managed the distributor case for Dallas County. The big three, that's McKesson, AmerisourceBergen, and Cardinal, are paying $1,167,644,106.34. That's going to be over 18 years, plus a significant portion of fees and cost. Now, I want you to know that because of the tobacco litigation that took place decades ago, most of the settlement structures that have been designed in the opioid litigation are different, and they're designed to address problems that the tobacco litigation brought on. Like, no one really wanted the lawyers to make all this money. No one really wanted the state to be in charge of all the money and spend it in a way that, wasn't really addressing the problem. It seems like the tobacco litigation put a bad taste in a lot of people's mouth. And so a lot of the structure that we've come up with through the term sheet has been in response to the tobacco litigation, hopefully to address some of those issues. You're going to find out, when you approve the settlements, hopefully you do, Titus County is going to be getting roughly $83,000 from these three settlements to do with whatever you want. Now, Titus County also approved the Johnson & Johnson settlement, which if you add all of these settlements together, will be about $102,000, no strings attached, money for Titus County. Now, as far as the Region 1 funds that Titus County will have access to in the Abatement Fund, those will range from $40 million to $51 million. And some of these figures are still in process. We've hired one of the nation's best economists to calculate these numbers for you. We believe it's going to be really close to what I'm telling you, but there could be some change. I just want to let you know that.
Is that for our region or for the state?
For your region.
For our region, which is roughly how many counties?
That is, I want to say about 15 counties, not high in population. 40 to 50 million. I've never seen a grant that big. I mean, it's just unheard of. Even the $102,000 here, I've seen grants that Dallas has applied for just for Dallas that are, that's a pretty average number. So it's really hard to get free money, and I'm really happy to be standing here in front of you today telling you you're getting some free money, and not only that, you're getting access to a lot of money that can help people in your county.
Does that term sheet determine how that money is distributed and how it flows?
Yes, sir. Yes, sir. As far as fees and expenses, you're going to see when I give you the slideshow and executive session, it'll have all these numbers. The attorney's fees are split among every lawyer who's worked on this case for the past 3 years. Just to give you an example, this is all I do for a living. day in, day out for 3 years now. And so, my boss has fronted all these expenses, the database, the experts, the scanning, the autopsies, everything. And so that's where the fees and expenses are coming from. And the defendants are paying these. I want you to know that the only time we're going to come back to the counties to ask for fees is if we can't get made whole through what the defendants are paying and through the national pot. And then it would be 1/254th of whatever the number is. So we've really done our best to make sure that the attorney's fees and expenses are not a regressive tax on the counties. Everyone wants the counties to have this money so that you can help the people who are suffering in your county. That's really the long and short of it. To date, this litigation, I'm very proud to tell you, has raised, for lack of a better word, about $1.8 billion. And that's nothing to, that's no joke. And we fought for that money. It wasn't free. So I'm very proud to share this news with you all, and I'm thankful for your time. Thanks for working me in. And we'll get you everything you need in the next few days, and y'all can just vote on it. Anytime before March 10th will be great. That's our deadline.
As far as the information that you're referring to for executive session, is that something that you can, is that in print form or it's only?
It is, Judge, and I'll have the slideshow that I'm reading off of right here. You'll have a copy of it. Okay. And if you want to do executive by Zoom or by phone, I'm happy to call in. I can even come back out here if it's on a day other than Monday and Tuesday. My Mondays and Tuesdays are pretty booked up from here to March 10th.
Here's what I'm thinking is
yes,
that we get you on we gather together in executive session and we can just listen to you over a phone. We'll sit down here at the table with our handouts and you can guide us through whatever we need to know. As far as the approval, I mean, are you dealing with any counties anywhere that have not gone along with this thus far? I mean, I can't imagine what possible reason you might have if we come this far why we would not approve. Is there something that you need to tell us for our consideration? Here's the other side of the coin.
No, sir. It's our recommendation to all of our clients that it be approved. This settlement was very closely negotiated with the Attorney General. I think you might recall the Attorney General contacting counties, at various points throughout the past 6 to 9 months. Right now, we're on the same page. We're on the same page with the settlement. It's not a matter of you having to choose one or the other. This is the settlement that we all agree on.
You expect that to continue?
I do.
You think you've come together?
I do. It's really been a marvel. The way that on this one issue, partisan politics really shouldn't matter, and it really hasn't that much. We all agree that there are people that are really suffering that could use a little bit of help. And so we're all doing our best to work together as one to get the people of Texas the help that they need.
The state got the recognition they thought they deserved?
I believe so. I believe everyone's happy. That's a little bit above my pay grade, but not too far.
Well, that was always kind of my opinion, is who's going to get the bragging rights over this deal, and certainly politicians like to have that.
We absolutely yield to the Attorney General to take the bragging rights. We just want the work to be done right.
Yeah. Okay. Do you have the handout? Are you going to send me those by email? Do you have them today? Tell me what you would like to do.
I can send those by email. I believe Tracy, my paralegal, has sent them. And I don't know exactly what the rules are for being an open session. I mean, I could hand you what I have in front of me, but I don't know if it's a part of the public record because I'm speaking in open session right now.
Yeah, let's hold that just to be sure. Let's hold off on that. I think that you could probably provide that for me, and I can distribute that during our executive session. And I'll talk to these guys that maybe that will want to. You said the days you couldn't come were on Mondays and Tuesdays.
I'm booked in most commissioners' courts on Mondays and Tuesdays, but only in the mornings. I could easily, pop by in the afternoon or get on the phone.
Well, I'm saying if we did it maybe not on a Monday or a Tuesday and gathered like on a Thursday at a time of your choosing, we could all meet up here, go immediately into an executive session and let that be the only. Well, the other item on there would be for approval after we came out of executive session. Could we make that work?
Sure,
Okay.
whatever works for you. And I'm happy to hang around, today, if y'all go into executive session and want to.
Well, we're not going into executive session today, so I don't want to delay you any more than we have to. What if I got with your paralegal and set up an appointment
Sure.
time? How much time would you need with us in executive session?
No more than 20 minutes, I wouldn't think. It just depends on how many questions you have.
Okay. Well, I'll get a time from her, and then we'll let you be wherever you need to be on the phone. We'll gather here together. I'll give those handouts, make them available to the commissioners, and get it done that way if you think that's the way to do it.
That sounds great. Thank you so much, Judge, and honorable members of the court. And best of luck to you as early voting starts soon, and I see all the signs up and down.
Starts today, yeah, it's already started. Okay, anything else, commissioners? This isn't really, this is just public comment time, so there's no decisions going to be made today. But while Jody's here, any questions you might have?
Well, next week we have to go to College Station.
Next week we'll be in school.
Yeah, next week, and that'll be Monday
Monday through Thursday.
Monday through Thursday.
We'll be
Okay.
back late Thursday.
What about something this Thursday afternoon or Friday possibility? I'll ask you all when a
Okay.
convenient time would be. The only deadline we've got is we want to be, I'd certainly like to do it no later than the next Commissioners Court meeting in 2 weeks. We don't want to push that March 8th deadline that you've got. And like he said, they'll be out of town for training next week. So what would you think about this Thursday or Friday in the afternoon?
Sign me up.
Friday be better for me.
I'm out Friday.
I'm all good on Thursday.
I'll be out all day Thursday.
You'll be out all day Thursday, okay. All right. We may have to postpone until, let me just get with them some more and look at everybody's schedule, see if we can come up with something.
3rd or 4th of March.
Okay. All right, Jody, thank you very much. We
Yes,
appreciate
thank
it.
you.
Thanks for all the
Honor.
work that's gone on
Thanks.
behind the scenes.
Thank you.
All right, item number 6, consider and possibly approve the Prosperity subdivision in Precinct 4 on FM 1735. Commissioner Parker, any general comments you would like to make about the Prosperity subdivision before I give you some details from Clint Bain? We do have the plats here.
No, Judge, I have met with them. Everything looks good. We talked about, the needs and everything, and they have gone above and beyond what they needed to do to get it ready. So,
Yeah, I agree. We've worked with Bonarico, Bonarrico, Mr. Carlos Bonarico, owner of Bonarico Homes. We've worked with them before. They do have a very complete package here, including power of attorney and bond related to the roads. Let me read a brief synopsis here from Clint Bain. Bonarico Homes has submitted an overall site plan for on-site sewage for the proposed subdivision on FM 1735. Mr. Bonarico proposes to subdivide a 20-acre tract into 16 lots, 15 of which will be 1 acre each of usable property, with the remaining lot being a 3+ acre tract that he will retain for his own home site. Mr. Bonarico plans to complete the subdivision in 2 phases, with the first 6 lots being Phase 1. The subdivision will be accessed from FM 1735 by a new road, which Mr. Bonarico plans to construct to Titus County requirements, including bond requirements. When reviewing the preliminary survey, I observed that the road is drawn with a 60-foot right-of-way and a cul-de-sac terminus with a 50-foot radius.
I've reviewed the overall site plan for on-site sewage completed by George Sanford, and it meets the requirements listed in Section 285 of the Administrative Code. I see no reason to prevent the development of this property.
Brian,
Yes,
I might say too, this is his daughter's back here on the back here.
Back
So-
here in the back?
Yes, sir.
Okay, welcome. Anything you would like to tell us? Well, we appreciate the thorough package of information that you've brought here, and this does front on FM 1735. I want to show you all just briefly what this...
It will be a gated community out there. They've already got the entrance and all.
Let me let the two of you all look at this reduced version. Let them look at that reduced version. So you'll see there on the far right, you'll see that that is 1735. So you have a rectangle there. The short end of that, the short side of that rectangle fronts on FM 1735. And into the subdivision is one long straight road with a cul-de-sac at the end. On either side of that road are 1 acre lots. And then we have that 3 acre lot back there in the, I guess that would be the southwest corner. So a very simple layout, just 2 rows of lots, each facing this new road. The 2 lots on the far east end adjoining FM 1735. So he has met all the size requirements of 1 acre. We have George Sanford's on-site sewage plan. We have electricity available, water available. We have a bond here, $40,000 bond that will ensure that the road is built to county specs, which I'm sure that Jimmy will watch over. It looks like everything is in order here. Do you have any questions that maybe one of these ladies could answer, or that Jimmy could answer, or that I could answer? Well, if not, I will ask for your consideration to approve.
I make a motion, we approve the...
Motion is made by Commissioner Parker
Second.
to approve the Prosperity Subdivision Phase 1. And again, we're approving 6 of those ultimate 15 lots. So it's just Phase 1 at this time, total of 6 1-acre lots.
Second.
Second by Commissioner Applewhite. Any further comments, questions? All in favor of approval, Phase 1, Prosperity Subdivision, say aye.
Aye.
All right.
Thank you, Cole.
See you, Cole.
Go.
All right, we'll get to road reports from our commissioners. Start with Commissioner Parker.
We've mostly been doing patching and whatnot. We had a couple of culverts we had to get put in, but mostly that. And along with that, I'd like to say I am still looking for a bucket truck. I've talked to Bowie Cass. I think I mentioned this the last meeting. I'm trying to get a hold of Jennifer out at AEP to see if they might have anything. Don't know for sure yet if Prefert has gone through ours or gone into ours to check it, but I don't think there's anything that we're going to be able to do to it. It's old and all. I'm afraid it's going to be more money than we even need to think about putting into it. So I'm still looking for a bucket truck, and we'll see what we can do with that. If
Does each precinct have a bucket truck?
No.
No.
it's one that we share. It's
One
in
that
our
we
pool.
share. Okay.
And the one we've got, it's a 76 model, I think it is. And it's in pretty bad shape, and it started leaking around
The ring seal.
ring seal and all on the turret up there. And most of the time when they go into those things, from what they tell me, it's outrageous, the prices, because they have to replace all the seals and everything in it. So they're still, Preference is still looking at it, but I don't think they've got us a possible bid or anything for fixing it. But from what they're telling me, I don't think it's going to be feasible to even fix it. So we've got a lot of trees. I do. I know the other guys do. A lot of trees that need to come down, but without that bucket truck, it's going to be almost impossible without hiring somebody to do it, and that gets expensive quick.
So that's a piece of equipment that's used a lot during tree trimming season?
Yes, sir. This time of year, I mean, we don't do anything unless it's something we have to do during the summer and all, when we're chip sealing and all. But this time of year is when we try to get all of our dead trees down, and the ones that we can't trim with our side cutters and all of that. That's what we use it for.
And so you're talking to these other entities to see if they might have hand-me-down for sale or something?
Yes, sir. Yes, sir. Sale or donation or whatever. Sometimes AEP and Bowie Cast will donate, but that they've got from what they tell me, they've got a waiting list, on them. So, but I've got to get with Jennifer again with AEP and see if they have got anything, and or might have something coming up in the very near future.
You got your big culvert project all finished?
Yes, sir. It's all finished. Everything's looking good with it. I went down by there after we got that couple inches of rain we got last week or week before, and everything looked real good. It's draining real good, and I'm very pleased with it.
Okay. All right. Commissioner Applewhite?
Well, we've been putting in culverts. We put in 3 last week, and we are getting the oil change in the shared equipment that we told them we would do, and we got all of our machinery oil changed. We're getting ready for the summer, and we're out patching today, starting today, all over the county for Precinct 3.
All right, we dug some soft spots out on 2670 and 4410, and we paved over those. And we had some washouts on the edges of the road on 1150 as well as 2910 that we repaired. We replaced 3 signs, and we put in a culvert on 2300, put in a bridge rail on 2930. And also, we've got a safety meeting set up with Texas Association of Counties. Isaac Garcia is coming down here with his team, and we're going to go over a 4-part safety meeting on March the 8th at 8 o'clock to 10 o'clock at the County Extension Office. And that helps us to be safer and have a safer for our employees, and it also helps us on our insurance rates to have these classes. So looking forward to that, March the 8th. Thank you.
Commissioner Parchman?
We've been mostly scabbing and patching, placing a few culverts, had a new man hired. We've been training him on the side cutter. We've also got our big culvert replaced on County Road 1670. That was a big success, but helped Precinct 3. I appreciate you guys helping us on that. Did really well. That culvert was 8-foot diameter, 55-foot long. Well pleased with the way it turned out. Dennis Cameron put it in for us, and turned out quite nice. Very proud of it.
All right. Anything else? Thank you. Item number 8. Consider and possibly approve the appointment of Nathan Tafoya to serve as the Titus County representative on the Northeast Texas Regional Mobility Authority for a 2-year term beginning February 1. As you will recall, a couple of meetings ago, we appointed, or we thought we were going to appoint, Commissioner Fitch to serve on the NET RMA, but unfortunately the NET RMA took a look at that and said, you know what, unfortunately we cannot have an elected official serve on this board, so please find us somebody else that is not an elected official. Nathan and I had talked about this previously. He expressed a willingness to serve on the net RMA, and so I am bringing that name to you to see if you would allow Nathan to take that role. You'll recall that is Nate Preifert asking to retire from that appointment and allow someone else to continue in his place. This is a 2-year term beginning February 1 of this month, so we're a few days late, but I would like to be able to tell Net RMA that we have approval. They do know about the consideration of Nathan Tafoya.
Make that motion.
Motion to approve Nathan for the Net RMA is made by Commissioner Applewhite.
Second.
Second, Commissioner Parchman. All in favor, say aye.
Aye.
Number 9, discuss employee sick pay benefits with possible action. This was something that Commissioner Parchman brought to my attention, and I want to give you a little bit of background information here. Bear with me just a second. This is some information that's been summarized nicely by Barbara. The current limitation on the accrual of sick leave is 480 hours. That's what we're going to discuss here, is how much accrual are we going to allow on sick pay benefits before we put a cap on it. Right now, it's capped at 480 hours. Employees accrue 4 hours each month of sick leave. If they retire and they've accumulated a bunch of these hours, you know, some employees, depending upon the position that they have in the county, it's a whole lot easier to take sick pay than in some departments, specifically law enforcement, specifically work for the commissioners. And it's tough to pull guys like this, I better say guys and girls, when they're working in these positions. And so we, several years ago, when we put our policies together, we decided that 480 hours of accrued sick leave would be appropriate. If they are unable to take sick leave during the year, they're not sick, they don't take the time, they can accrue that time. However, another one of the changes that we made at that time was that if and when they decide to retire, an employee is only paid for 25% of whatever that balance is. Let's say they have 100 hours when they retire, they are paid for 25 of those hours. If an employee leaves for other than retirement, they are not paid for any sick time. So again, I needed to be reminded of those rules because I was thinking that we were accruing and building up a large unfunded liability that the county would have to ultimately deal with when someone quit or retired. And that can wipe out a small departmental budget real quickly. But again, if they leave for other than retirement, they're not paid for that. So there is that motivation to take these sick hours in those situations. But again, some departments, it's tough to take it. Sorry, guys, I can't let you go. I'm short-staffed as it is. And so I think that I'm going to let Commissioner Parchman kind of tell you how he feels about it and how it affects his department. We've got Sheriff here. Sheriff may want to chime in. But one last thing I want to say, we currently have 7 employees who have accrued over 400 hours of sick leave. 6 of those 7 are in the Sheriff's Department and 1 is in Precinct 1. These employees all began working for the county somewhere between 2003 and 2009. And so therefore, I know that Commissioner Parchman is interested in considering raising of that number. So Commissioner Parchman, let me kind of turn it over to you. You kind of give us your opinion on this and why you believe this is the fair thing to do, to raise the...
like Ms. Barbara said, it's going to affect about, 7 employees, Barbara, is what you said on that? And like I say, one of them was mine, my employee, and the rest of them, I believe, in the Sheriff's Department on that, and I believe it's cheaper to raise up the hours than to hire other employees, and I don't believe that. I believe the employees have earned their time, and I don't believe we should have to send them home and penalize them and say, hey, you got to burn your hours and you in order to receive any more sick time. I just don't think that's right. I think that sick time should be there for the employees when they need it, and the ones that have been dedicated and loyal and came in, and worked hard. I think that time should be there, if they need it. So I don't believe we should have to send them home and have them burn that time. I think we should give them more time.
And why are they unable to, what's unique about your department where these guys can't find an opportunity to take that sick time during the year?
We could on rainy days, but here lately we haven't had any rainy days, and we're getting into springtime and the summer months, and then that's going to be the best time of year, critical time of year. I need my employees there. I just don't believe anyway. I don't think we should penalize them and send them home and say, have to burn that time. I think they've earned it, and I think they should be allowed to keep it and use it however they want to or when they need it. So that's how I feel about it.
Okay.
Can I chime in? When I first contacted about this did seem like a good insurance policy just for the employees that have been there a long time. Now, make no mistake, I don't think we should use sick time unless you're sick. I don't think we should be able to use it, period, unless they're really sick. But because it's what we got vacation for and comp time for on the other. But my only question is, and concern, when I believe Barbara's one that sent me an email on this. Like I said, I'll say it again. I do think that it would be a good idea to do this because it would be just a little bit more insurance policy for the people that have been here for 20 years or close to it. But currently, the federal law allows us to let people go if they go for 12 weeks. That isn't like correct?
Yes, sir.
Okay. That's where my concern. I got to think about this because I spoke with Jeff about it and told him I was actually in favor of this too. But get to thinking about that. Is that going to be an issue? Because let me give you an example. I believe I got elected in 2008 to start in 2009, which this is not bad. I think I've had to let 2 go that wouldn't come back off of FMLA. These employees that I had to let go had no intentions of coming back. They used that, and of course they didn't have enough sick leave that was unpaid, but still they got to stay on and get the insurance benefits that the county offers. And that's the only reason they stayed on. Now, where that hurts me is, more especially these days, it's harder. It's getting very hard to find good help, hire people. Retain them it's an issue too, but not as bad as finding the people when we do have an opening. So therefore, when you get someone that's off 12 weeks, they have no intentions of returning, they don't care that I can't hire anybody and get them going because, we've got, we hire them to work. We don't hire them to send them home and draw pay. And so if we go to this 600 hours, past what we're at now, that's going to put us beyond FMLA. Is that going to keep us from letting them go so we can get people in that want to work? Is that going to be an issue, a legal issue, of letting these people go if we do that? Is what my question is. And this, we may need to table this and keep it tacked, because if we're going to have to hold on people for 15 weeks, I would say we don't need to do this. If we're going to have to hold on to them. If not, if we can still do this at the 12 weeks that FMLA, especially you got people who are not getting paid because they don't have any sick hours. But if it's going to keep me from getting someone in and getting them and start getting someone processed, get them hired, then that's going to, if we're going from 12 weeks to 15 weeks, that's going to be not good for me.
Where is 480 hours versus 600 hours? How is that important to you in your department?
Well, like you say, like Jeff said, pointed out, there's not very many people even that sheriff's office even have that. And it wouldn't be an issue with me. The 600 hours, if we go up to that, would actually just be a good insurance policy for the ones that do stay there, and I'm all for it.
What do you mean by insurance policy?
Well, I mean, just in case they did have something bad to happen, they'd get more pay, and they wouldn't run out of pay at 480. They wouldn't, in 12 weeks, they wouldn't run out. They would be able to get, several more weeks of pay to help them out so they can get back to work.
So is it more of a, well, I want my folks to be able to bank these hours in the event that they have a long-term illness?
Right.
Because the fact that there's 6 of these employees and you're out of the 7 are all in your department, countywide, I don't think, it's a whole lot easier, I guess, in other departments for somebody to take that sick time during the year, and they tend to do it. My only concern is, are we using this as a savings account? And how much is enough? 480 hours? I thought that would take care of anything that could ever possibly come up. And now 600 hours? And granted, we only get paid 25% if and when they retire, which is not a real good return on your money. It seems like I'd find time to take that time, during the year. If I needed it. But you said an important statement. You don't believe that sick time should be used other than for being sick. Well, that's kind of what I think, too, that it ought to be used for sickness. And so how much is reasonable to be built up in the way of sick pay where we're taking care of our employees? I think that's just the question.
And I don't personally have a problem. The 600 hours is not going to affect me any bad unless it goes over that. And I didn't have time to get with Barbara on this because I just got to think about it over the weekend since the meeting was coming up. But now, if it's going to make it to where it's going to change our 12-week FMLA by law to 15 weeks, then if y'all don't think it would, then I don't think it hurt. I think it also not going to really be any big changes. Like I say, when they retire, it'll cost a little bit more, but that's going to be far.
Well, what's the benefit to you of us going from 480 to 600?
Well, just in case some of my long-term employees that don't use that sick, in case they did have a family emergency and they needed it, it would be there for them.
But how much is reasonable for a family emergency?
That is for you guys to figure out today. 12
weeks, 15 weeks? I mean, wow, that just seems like we're getting this thing higher and higher and higher. I was wondering if it was just a matter of, I can't allow these guys to take their sick time, so in order to be able to retain those guys, I need to be able to promise them that they can, save up that money in this savings account called sick pay.
Yeah, I don't allow that. I watch pretty close to the sheriff's office because, like I say, when I hire people to work, I want them to work. If they don't want to work, they can go somewhere else that, in my opinion, where they can come in and get paid, don't have to work. So I don't allow, I have actually let people go for abuse of sick leave. And it's a little harder to do. I mean, you have to, you get with TAC and get with your attorneys. But I can think of one I have. But yeah, it's just, I don't know if that's my only concern about this deal, is if it's going to keep me from having to do what I need to do in 12 weeks versus is it going to cause us an issue legally if we go to the 15 weeks.
Judge Lee, may I?
You may.
If y'all saw me looking at my phone during court, it's because I am in contact with Michelle Arsenault. She's our HR person at TAC. Let me just read you what it says here. First, I want to tell you, FMLA requires that we hold a position for an employee up to 12 weeks, and they're also required to concurrently, at the same time, use their sick leave. That's a federal requirement. It's not anything that we can change. Now, what Sheriff is referring to, if we move from 480 hours to 600 hours, that's 3 more weeks. So if they had 600 hours accrued and had an emergency that made them have to take all of their 12 weeks of FMLA, then they would have 3 weeks of sick time left. TAC says it's basically a local decision. Let me make this big enough so I can read it. Bear with me here. Their recommendation is whatever our hours change to, that those would be used to support the additional time might be a reasonable accommodation. And then they go on to say, if you've waited 12 weeks, 1 to 3 more weeks might be reasonable. It is a best practice and not required, but we would have to update our policy to say so. Because our current policy says that you can only take that time for sick leave. And it says you yourself or your immediate family. And so I think what it looks like to me from reviewing the documents, I think through the years some elected officials have been a little looser with that than others. You know, I think mental health days are important in some cases, especially if you work in the sheriff's department. They may have had a really bad day and he needs them, or a car accident, you know, he needs them to be off. Y'all could have that too. So I'm the one who first mentioned this. I brought it up because we have people who are going to be approaching 480 who are not going to get any more time. And so the decision then needs to be made, we want to leave it like it is, or do we want to move it to 600? It does not matter to me what your decision is.
So even if we move it to 600, you can still go by the 12-week?
You can still go by the 12 weeks.
Okay.
But at that time, we want to make sure we have to treat everybody the same. So I would recommend if we do that, we make our policy, we just add a sentence to our policy that says, you know, if they have any more, you know, we're not going to pay that. Whether or not they might decide to get an attorney, you know, that would be their decision.
And I'll give you an example. The last one that I had to let go from FMLA was when the COVID hit, 2 years ago? It was a jail employee that said, I'm just not going to work in here and have all this COVID, be around this COVID. So they went and got a doctor to give them an excuse. And even some other employees that was friends with this employee that left, that said she's done told us that she's not even, she has no desire to come back here. But then when the note would run out and say, hey, they're able to come back to work, we'll then go to a different doctor and, oh no, we're going to, yeah, you're feeling bad. And did that for 12 solid weeks, and then we had to let them go, and they had no intentions of ever coming back. And so that's why I say, if it was an employee that had a real medical issue, I don't have a problem with going another 3 weeks, but most especially because and if they've got time built up, then, somebody's been here 20 years, I don't have a problem with it. I think it's a good thing. But when you get these people that use their sick leave for vacation, and they use it quite often, I just don't want to have to hold them past the 12 weeks because of some legality deal, and they don't have any intentions of coming back, and they're just going to keep me from hiring somebody and use our insurance. So that's my concern.
Pretty, did you have something to say?
Question. I'm confused. Are y'all talking about?
Pass that mic down.
Are y'all talking about them being paid when they retired, or are y'all really sending guys home when they're not sick because they've just gotten up to that 480 limit and then they get to go home and start using that when they're not sick? I'm confused about that.
That's what I'm against. I don't want to do that.
Okay, so if they get 480, I consider it they're lucky that they haven't been sick, and can they not just log that in and they don't get any more hours? But if a catastrophe hits and they do have their 12 weeks of FMLA, then when they come back after 12 weeks, that would start all over adding up. So I guess I'm confused at what you were wanting to do. You think somebody needs to be off 15 weeks for something?
No. I'm not telling them. I'm against sending the employee home and say, hey, you got to burn your time in order to get any more sick time acquired. That's
what I'm talking about. Why would you make them burn it off to get more when
because they're at the 480 mark right now, and they can't accumulate more.
Right, but that's 12 weeks.
Right.
That's your standard FMLA if they're that sick. I'm against giving them. I'm against sending them home to burn off anything if they're not sick.
Yeah, I am too. So.
Well, again, my position on this was the same as it was when we established this. I felt like 480 hours, and I know it was a different group of commissioners at the time. Sheriff was in on that conversation. We felt like 480 hours was a very reasonable time, and it would encompass 999 out of 1,000 situations where somebody had a long-term illness. I believe that once you cross that line, it begins to be psychologically treat it as a savings account. Granted, not a real good savings account because you're only going to get paid 25%, and if you leave for any other reason, you're not going to get paid any of it. So that's why I think the 480-hour cap is reasonable, but Jeff felt differently. I didn't know how you all would feel, didn't know exactly how the sheriff would feel, but you know, that's what we're here to discuss. I do think we've got to get back to the original, what's the core reason why we have sick pay? If you get sick, you have an opportunity to still receive a paycheck, you know, while you're not here. And the ability to accumulate up to 480 hours, that is a bunch of time. That's 12 weeks.
Good.
That seems reasonable to me, but I'll be quiet and let you all talk.
Like I said, I hate to penalize good employees that have been here that long. And but
tell me how it's a penalty.
Well, like I said, you know, they've been here, and if they do get sick and you go over the 12 weeks, and, you know, we're going to give them extra because, you know, if they could get cancer or something like that, you know.
Does anybody remember anybody ever having to be off 12 weeks because they were sick in the last 10 years? 3 weeks, 4 weeks?
It was before my time. I think Judy had an employee that had some kind of cancer, and she was off for quite a long time. But she had worked for the county for a long time. I don't know if she was required 480 hours, but I do know that she was on FMLA without quite a while. I don't think it ever got to where we were talking about it going over the 12 weeks, and then if she had extra time.
Barbara, is it a fair statement, Barbara, that most employees find a way to take their sick time during the year? So this affects really a small layer of the county employee population, and it tends to be in those departments where finding time to take off becomes more difficult.
Yes, sir, and I went a little further and looked at our totals, and we only have, countywide, we still only have about 5 other employees who are over even 300. So it's not going to impact a lot of people.
Mm-hmm.
So I think most people are able to take their time off. It's really the ones who've been here for the longest.
So my point is that, generally speaking, the county population is not too concerned about banking a large number of sick hours. They're going to use them when they are not feeling well or whatever the case may be, and use those hours during the year or during a 2-year period. And so are we more, is the employee that works as for a commissioner or works for the sheriff more concerned about a long-term illness? I don't know. I don't know all these answers. But I don't see that it's a penalty, you know, once you hit that cap. It seems like it ought to be, that time ought to be used. I'm not saying somebody ought to say, oh, well, I didn't get sick, so I'm voluntarily giving up those hours. That's not what I mean. Whether I look at this more as personal time rather than sick time, we've talked about renaming it. There's nothing wrong with calling it sick pay as opposed to personal time. But I think that's what primarily it gets used for, is personal time when somebody's feeling less than optimal, or they're taking somebody else to a doctor's appointment. I mean, there's any number of things that this time can be taken off for. Anyway, we've had a couple of comments that it's not fair to cap them at 480.
I'm going to make a motion that we raise it to 600 hours.
All right, call the question. There's a motion by Commissioner Parchman that we raise the sick pay that is currently capped at 480 hours, with the reminder that 480 hours is only paid if they retire at 25%, and if they leave for any other reason, they don't get that benefit.
Do we need to add in that FMLA on that too?
I don't think we need to mention that if we don't have any intention of changing FMLA. But anyway, we have a motion. Commissioner Parchman raised the cap county employee-wide to 600 hours from 480.
Second.
Second, was that Commissioner Applewhite? Second, Commissioner Applewhite. Any further discussion, comments, or questions? All in favor, say aye.
Aye.
Opposed? One?
No.
Two?
I'm opposed to it.
You're opposed? Okay. Okay, well, yeah, I didn't hear you very loudly. All right, well, that does not pass. So, thank you for the input. I can certainly see both sides of it, and it was worth a discussion. Items number 10 and 11, I just, it was looking like this was going to be a short agenda, so I just kind of threw these on there just as food for thought. You've heard that we've got a nice fund balance, and we've talked about these things, or at least we've talked about the annex remodel, but I wanted to discuss these one at a time, and we can discuss them together. But item number 10 is discuss the exterior of the courthouse annex as a remodel project with possible action. And I'm talking specifically about that north-facing wall of the annex that is obviously a bit outdated. It's structurally unsound. It's unsightly in light of the refacing that we're seeing on a lot of our downtown businesses, and I just want you all to be thinking about whether or not you are ready to sit down with the cooperation of possibly an architect and the Main Street Committee, talk about refacing that building over there. I'm not talking about remodeling the courthouse annex. We've certainly spent a good deal of money getting the DA's offices built over there. They've turned out nice, and we're utilizing that space that was previously empty. I'm simply talking about something that would make the exterior appearance look good there.
So I think it's something that's definitely needed. Talked with some other folks about it here recently, and they said, I was talking about stucco in it and kind of modernizing the front like our courthouse is stucco, and they said maybe we want to brick it so it matches some of the other downtown buildings, kind of keep it in the same themes or something. So we need to get some good ideas about it. I'd also like to get the courthouse painted, on the exterior of the courthouse painted. It's looking like it needs a paint job to me. So I'd want to incorporate that into this, resurfacing the front of that annex and paint the courthouse. What do you guys think?
Anybody else have any comments on that? Everybody's happy with the annex?
I do think we need to look at doing something over there to it. I know there's a lot of other businesses downtown that have done some frontal work on their buildings and whatnot, and that one does, and it's could become a hazard over there with that stuff falling off. I know I got into it when I was at Chapel Hill. We had a wind come through, and a big chunk of the front of the building fell off because of it got some wind in one of those holes that was in that stucco, and pulled a bunch of it loose and everything. So I do think it's probably something we need to look at.
Would you be willing to, if I laid a plan in front of you right now that you liked, would you be willing to fund it?
Probably so.
I don't have that plan, but if I did.
Yeah, probably so.
You feel like we need professional help to do that, services of an architect?
I'm not sure about that. I think we could bid paint jobs, resurfaces. We can bid that out ourselves, get a little committee together maybe.
Well, I think we need help.
With an architect?
Well, somebody that's got more skill than I have to decide what that big, long wall should look like. If you're just going to go up there and, I'll get to you in just a second, if you're just going to go up there and
replace one surface with another, you may want to reconfigure windows, doors,
That's true on that.
entryways, signage. Yes,
Make it look
Scott?
good.
You mentioned the Main Street. I know they have some sources there that can probably help out. Maybe get your feedback.
I don't know how alive and well that committee still is or not, but I know that they use architects and they're.
Bring in architects, a lot of folks have used them in the past, and I don't know whether it's an active deal currently or not. If it's available.
We would certainly, any free professional help would be good. Anybody think that it's not the right time to be spending money on the annex?
I think if we don't act on it now and a few holes in this courthouse, we're going to be spending a lot more money repairing the damages from water. So,
When you say architect, are you referring to Freeport's guy again, or was he just an engineer on that?
They were just the engineer. Now, they utilize architectural firms, but I don't have anybody in mind at this point. I just want somebody that could put together maybe 2 or 3 options as to what that could and should look like with different materials, different.
I would be for it. I guess just depends on what it costs. I guess we're not going way overboard with it.
Okay.
Might be something that we could look into, like that Scott was talking about there, that the Main Street, they might could help us out with something, or they may have somebody that they have used in the past on some of these other businesses.
Well, how about this? How about somebody give me a motion that would authorize me to have a conversation with somebody on the Main Street Committee, at least just to get the conversation going and find out what services might be available to us if we were willing to commit to a beautification project.
I make that motion.
Okay, the motion is to authorize county judge to speak with members of the Main Street Committee here in Mount Pleasant to see what services would be available for a
Main Street
beautification project on the annex and main courthouse building. All right, there's a motion.
Second.
Second, Commissioner Applewhite. All in favor, say aye.
Aye.
And this is just my idea here. You've heard Commissioner Fitch mention repainting the courthouse. Certainly not opposed to that. I would like to see if you all would be willing, or if you feel the need to look at redoing the landscaping around the courthouse. We haven't had any changes here in a good long time. You've got some trees that are really, really big that are kind of going their own direction. I would like to see us refresh all of our landscape and consider everything from the ground cover to trees to bushes to even considering a redesign of our parking areas possibly. That may be beyond the scope of the project that you all would be willing to do, but as a bare minimum, I just think our landscaping looks tired. I don't know if we're trying to hide our courthouse or if we want to show it off, but if we're trying to hide it, we're doing a good job because these trees are really covering things up. That's just my opinion.
I like the trees, so I'm a tree person. But I do agree we do need to freshen up some of our landscaping. So I'd like to get somebody to give us a plan on that so we can look at, hey, what can you do to kind of incorporate what we got and make it look better?
about with a motion, you allow me to begin some research with maybe some local individuals, companies. Maybe we need to get a professional landscape architect. Maybe we can do a lot. Maybe we don't need near that level of professional support. I just don't know on a project of this size.
Yeah, I make a motion that let's Judge Lee checks in, get us some bids on this.
Well, let's stop short of bids.
Just start talking?
I won't even go, I'm not going to ask for bids until I have
some
a
ideas.
defined
What we need.
project in mind. Just see about getting some professional opinions on what.
Make a motion, you get some professional opinions in on the landscaping.
All right. There's a motion.
Second.
Second by Commissioner Parchman. Any further conversation? All in favor say aye.
Aye.
Item number 12, consider and possibly approve a resolution declaring the county to be a sanctuary for the unborn. This was Commissioner Fitch's, don't know that it's his idea, but he thought it was appropriate after looking at some actions of other counties that we consider doing something similar here in Titus County. So Commissioner Fitch.
Okay, I would like to, I'll read this to you. Resolution of the Titus County Commissioners Court declaring the county of Titus, Texas to be a sanctuary for the unborn and urging the citizens of Titus County to promote and defend the unalienable right to life and the inherent dignity of all human beings, including the preborn from conception or fertilization through all stages of development in Titus County. So I am definitely pro-life, so I'd like to make a motion to pass this resolution.
Why don't you read those, the number 1 and number 2, be it resolved?
Okay, I'm going to do that and did. Be it resolved, Titus County Commissioners Court hereby recognizes and declares the full humanity of the preborn child and declares Titus County to be a sanctuary for the preborn, where the dignity of every human being will be defended and promoted from conception or fertilization through all stages of development. Number 2, Titus County Commissioners Court hereby resolves to present an ordinance in order to enforce the intent of this resolution by any means within its power in accordance with its responsibility as the people's elected local representatives.
What are the implications of this if we are to approve this resolution? Is this just the Commissioners Court taking a stand on this particular subject? Would this mean making any modifications to our policies, or what's next steps on this?
This would be just our Commissioners Court taking a stand for the right stand, and it's not making a law in the county by no means. And it just kind of takes a stand saying, hey, we're standing up for the right thing. It's not going as deep as making a law, trying to enforce a law that's not under our powers, that would bring a firestorm of lawsuits towards us from all kinds of ACLUs and different organizations. Just saying, basically, us Commissioners Court, we're pro-life. And we will try to do everything we can to stand up for that. I make a motion, we approve the resolution.
I'll second.
I have a motion. I have a second from Commissioner Parker. Any discussion or questions? All in favor say aye.
Aye.
Opposed? That's unanimous. All right. Thank you, Commissioner Fitch. Item number 13, consider and possibly approve the quarterly investment report. Barbara has provided that for you, and I'm pulling mine out here. Is there anything substantially new in the last quarter that we should know about? We've got a little more money. It looks like we've got a report here where you have reconciled the fact that all the monies that we are holding, most of which are on deposit with Guarantee Bank,
have some kind of protection. We have FDIC coverage capped at $500,000. We have Guaranty Bank's pledge of the market value of securities at about $23 million. We have a letter of credit for another $10 million, and that was Guaranty Bank. In the past, prior to the last couple of years, they always provided that in the form. Which was it? Was it pledged securities or was it a letter? It was always a letter of credit in the past?
Many years ago, they did a letter of credit. And then when I started, it was all pledged securities, and now we went back to that last year about this time. Back to 10 million of it, so about a third.
10 million of it is in the form of a letter of credit. And so between what we have, which is about $32.5 million of CDs, checking accounts, money market, and other accounts, the amount of protection, I'll call it, provided by Guaranty Bank through our relationship with them, we do have about $1 million of excess, I'll call it, coverage, so that the fact that we have exceeded the FDIC coverage with the amount of cash that we're holding is not a concern, because there are other ways to ensure that we are protected with the money that we have. Anything here in this report that you want to bring to our attention? You've listed out a page and a half of all the different fund balances in, from the general county to the individual operating accounts. Some of these are trust funds that are held by the county clerk, fiduciary accounts managed by juvenile probation, and then bail bond collateral that's put up by a couple of our bail bond community members.
The only other thing I want to mention to you, it's not new to this report, but I do want to have it read into the minutes. I'm required to monitor the financial standing of our depository, which is Guaranty Bank. Not that there's any problem with it. In fact, I follow the Bauer Financial website. It was recommended to me by another CPA many years ago. They rank Guaranty Bank as a 5-star bank. They say that it's good to have a bank that's either a 4 or a 5-star. To the best of my knowledge, Guaranty Bank has always been a 5-star rating. So I just want to call that to your attention.
And you're not utilizing any new investment vehicles? We're pretty much sticking to the same standard plan, despite the fact we're not getting paid much on our CDs. That's where we've got the bulk of our holdings, of our balances. So, Commissioners, if you have any questions or comments for Barbara, now's the time to ask. Otherwise, I'll entertain a motion to approve our quarterly investment report.
Make a motion.
Motion to approve is made by Commissioner Parker.
Second.
Second by Commissioner Parchman. All in favor, say aye.
Aye.
I'll send all these your way for a signature once I get to these other two reports. Item number 14 is approve oral and written reports. And again, Barbara has provided you with that information that you typically see every meeting.
Make a motion, we approve the report.
Motion is made for approval by Commissioner Fitch.
Second.
Second by Commissioner Parchman. All in favor, say aye.
Aye.
And then lastly, you have there item number 15, consider and possibly approve the treasurer's report.
Make that motion.
Second.
Motion by Commissioner Applewhite, second by Commissioner Fitch. All in favor, say aye.
Aye.
All right, so I'm going to send to you investment report, auditor's report, treasurer's report for your signature, please. Item number 16 is approved budget amendments. I have 2022-11 and 12 today. Budget amendment number 11 relates to Precinct 1, and you'll recall from the last meeting we accepted the donation of a truck. We have noted that value at about at $12,000 is how we are classifying that. So we are making an entry here, or this budget amendment, recognizing that donation of $12,000 in value. And then the second part of that item number 11 is Commissioners Court also approved the removal of the flatbed from that above referenced donated fire truck, and we're adding a dump bed to that. The truck will then be used as a new patch truck for Precinct 1. So we're taking $13,670 out of capital outlay, or excuse me, out of other road materials, and putting that into capital outlay to allow us to spend that $13,670 for that conversion from the flatbed to the dump bed. That is item number 11 as a budget amendment. Budget amendment number 12 impacts Precinct 4. You'll recall at one meeting, one of the last couple of meetings, we went through this for each of the other precincts, 1, 2, and 3, where after we got the results from our annual audit, we always wait until we have those numbers before we make this entry, but this enables us to quantify exactly what the fund balance of that particular precinct is to carry it over for use in the following budget year. So the road and bridge funds are special revenue funds, and the fund balances within them are designated for use by the commissioners for road repairs and to manage each precinct. The current budget for use of fund balance Precinct 4, as a result of the audited balance of $227,875, less a $50,000 set aside, same as we did for the other precincts. And of that contingency, $14,400 has previously been designated for the purchase of the double drum roller to be shared with Precinct 3, and therefore we have a remaining contingency balance of $35,569. So that's the $50,000 that we set aside, less the $14,400. He has a current contingency balance of $35,569, and then we carried over all but $50,000 of that $227,000 for him to use in the current year. We are, let's see here, we've got an adjustment here. We're increasing the budget in road material, other road materials, $100,000, road oil, $20,000, culverts, $15,000, and $600 for utilities, specifically water. And so of that $177,000 net, we are reallocating $135,000 of that, leaving him $42,275 for future use when he sees the need for that. So again, the purpose for this budget amendment is to recognize the amount of fund balance at the end of the audited year, September 30th, take out $50,000 for contingency and allow that for use during the current year. Those are the two budget amendments that I have, number 11 and number 12, for your approval.
Make a motion we approve the amendments.
Motion to approve these two amendments, Commissioner Fitch.
Second.
Second, Commissioner Parchman. All in favor?
Aye.
Say aye.
Aye.
Thank you. All right, item number 17, consider signing the pay orders and approving the payment of our bills.
Motion to pay our bills.
That motion is made by Commissioner Parker.
Second.
Second by Commissioner Fitch. Any comments? All in favor of approval, say aye.
Aye.
Item number 18, closing comments, if any. Thank you for your tolerance of a long agenda today. Thank you for your consideration of listening to Terry. I did not know how much Terry was going to be requesting. I was pleasantly surprised. I do want to put that on a future agenda at the point when we feel like it's time for us to start making some decisions on that and assist our hospital. We, like he told you, they're the lone remaining private hospital here and receive very little help in the way of tax receipts, and they've had a very difficult year. I think this would be one way that the county could show support. I'm sure that that would be a perfectly allowable use of those particular funds. Glad to know that our numbers are down sharply from the 22 plus that we had in the hospital here a couple of weeks ago. Commissioner Parker, any comments? Commissioner Applewhite, Commissioner Fish.
Remind everybody we'll be out next week. We'll be back Thursday evening, going to College Station for our annual PG Young School of Commissioners and Judges.
Yeah, thank you for bringing that up. So just as a reminder, while these commissioners are away, obviously they may cross paths with one another. They may be sitting in class with one another, but they are not conducting county business while they are gone. So we hope you have a productive trip. Commissioner Parchman?
No comment.
Okay. Today is first day of early voting. We've got 2 weeks of early voting connected by a weekend of early voting this coming weekend, and then a 1st of March vote. So a lot of things going on in the next two weeks. And that's all I have. It's 11:10, and with your motion, we will adjourn.
Make a motion, we adjourn.
Motion by Fitch.
Second.
Second by Parchman. All in favor, say aye.
Aye.